This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am Anuja Kumar and with me is Renuka RS. The headlines. Prime Minister Narendra Modi to share a video message with people at 9 a.m. tomorrow. Prime Minister interacts with all the Chief Ministers to discuss ways to check spread of COVID-19. Home Ministry blacklists 960 foreigners involved in Tablighi activities who came on tourist visa. Government launches Arogya Setu mobile app to assess and alert people on COVID-19. Government asks states to strictly implement lockdown measures in letter and spirit. Prime Minister Narendra Modi will share a video message with the people at 9 a.m. tomorrow. In a tweet, Mr. Modi said that at 9 a.m. tomorrow morning, he will share a small video message with his fellow Indians. Prime Minister Narendra Modi today held a video conference with all the Chief Ministers to discuss ways to check the spread of coronavirus. Defence Minister Rajnath Singh, Home Minister Amit Shah and top bureaucrats were present along with the Prime Minister. This is for the second time the Prime Minister is holding a video conference with the Chief Ministers after the spread of coronavirus. He had interacted with the Chief Ministers on the 20th of March. 328 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the past 24 hours in the country. With this, the total number of cases has now gone up to 1,965, including 50 deaths. Out of the total cases, 151 patients have recovered and discharged from the hospitals. Briefing media in New Delhi today, Joint Secretary Love Agarwal said around 400 positive cases of COVID-19 have been identified from different states including Tamil Nadu, Rajasthan, Delhi, Telangana, Jammu and Kashmir and Assam, which are linked to Tablighi Jamaat cluster. Mr. Agarwal said yesterday Cabinet Secretary Rajiv Gauba has asked the states for complete contact tracing of Tablighi Jamaat participants.
कल कैबिनेट सेक्रेटरी साहब ने सभी राज्यों के चीफ सेक्रेटरीज और डीजीपीज के साथ एक वीडियो कॉन्फ्रेंस के थ्रू तबलीगी जमात पार्टिसिपेंट्स की कंप्लीट इंटेंसिव कॉन्टैक्ट ट्रेसिंग और साथ ही वार फुट मेजर्स में कंटेनमेंट प्रोसेस के लिए सबसे कहा था. हम लोगों ने इंटेंसिव कॉन्टैक्ट ट्रेसिंग सैंपलिंग का प्रोसेस शुरू किया. अब तक करीब 400 पॉजिटिव केसेस आइडेंटिफाई हो चुके हैं जिनकी की एपिडेमियोलॉजिकल लिंकेज इस क्लस्टर से पाई जा चुकी है और इसके साथ ही एडिशनल टेस्टिंग भी चल रही है.
Mr. Agarwal also informed that an email ID technicalqueries.covid19@gov.in has been created to address the queries related to technical aspects. He said a guideline has also been issued related to kidney patients containing precautionary measures. He said Food Corporation of India is ready to provide 5-kilogram rations to the beneficiaries covered under National Food Security Act. Mr. Agarwal also said that Prime Minister Narendra Modi also held interaction with the Chief Ministers of the states on COVID-19. Joint Secretary in the Home Ministry, Punya Salila Srivastava, said that Home Ministry in collaboration with the states is ensuring the enforcement of lockdown.
लॉकडाउन मेजर्स का वायलेशन डिजास्टर मैनेजमेंट एक्ट और इंडियन पीनल कोड के प्रावधानों के तहत दंडनीय अपराध है और इस कॉन्टेक्स्ट में होम सेक्रेटरी ने सभी स्टेट्स और यूटीज को लिखा है कि पब्लिक अथॉरिटीज और सिटीजन्स के बीच इन कानूनों के प्रावधानों को वाइडली सर्कुलेट करें जिससे कि हमारा लॉकडाउन इफेक्टिव हो.
On Tablighi Jamaat workers, Ms. Srivastava said that 9,000 people who are Tablighi Jamaat workers having primary contacts have been identified and placed under quarantine, out of which 1,306 are foreigners and rest are Indians. She also informed that out of about 2,000 Tablighi Jamaat members in Delhi, 1,804 have been quarantined and 334 who were symptomatic have been admitted to hospitals.
The centre has blacklisted 960 foreigners who were found involved in Tablighi Jamaat activities at Nizamuddin area in the national capital on tourist visas. It has also cancelled their Indian visas. The Home Ministry has directed Delhi Police and Director General of Police of other concerned states to take necessary legal action against 960 foreigners for violating the provisions of the Foreigners Act 1946 and the Disaster Management Act 2005. The foreigners, along with others, were involved in Tablighi Jamaat despite the announcement of 21-day lockdown and social distancing measures in view of COVID-19, who reportedly led to spread of the virus in some people in different parts of the country. The government today launched a mobile app developed in public-private partnership to bring the people of India together in a resolute fight against COVID-19. The app, called Arogya Setu, joins Digital India for the health and well-being of every Indian. The app will enable people to assess themselves the risk of their catching the coronavirus infection. It will calculate this based on their interaction with others using cutting-edge Bluetooth technology, algorithms, and artificial intelligence. Once installed in a smartphone through an easy and user-friendly process, the app detects other devices with Arogya Setu installed that come in the proximity of that phone. The app can then calculate the risk of infection based on sophisticated parameters if any of these contacts is tested positive. The app will help the government take necessary timely steps for assessing risk of spread of COVID-19 infection and ensuring isolation where required. The app's design ensures privacy first. The personal data collected by the app is encrypted using state-of-the-art technology and stays secure on the phone till it is needed for facilitating medical intervention. Our correspondent reports available in 11 languages. The app is ready for pan-India use from day one and has highly scalable architecture. This app is a unique example of the nation's young talent coming together and pooling resources and efforts to respond to a global crisis. It is at once a bridge between public and private sectors, digital technology and health services delivery, and the potential of young India with a disease-free and healthy future of the nation.
Defense Research and Development Organization DRDO has developed a biosuit to keep the medical, paramedical and other personnel engaged in combating COVID-19 safe from the virus. Defense Ministry said the suit has been prepared with the help of the industry and subjected to rigorous testing for textile parameters as well as protection against synthetic blood. The protection against synthetic blood exceeds the criteria defined for body suits by Ministry of Health and Family Welfare. The ministry said DRDO is making all efforts to ensure that these suits are produced in large numbers and serve as robust line of defense for the medics, paramedics and other personnel in the front line combating COVID-19. It said the industry is geared up for production of the suit in large quantities. The current production capacity is 7,000 suits per day. The ministry said efforts are on to ramp up the capacity to 15,000 suits per day. Home Minister Amit Shah today accused Congress of playing petty politics over COVID-19. Mr. Shah said India's efforts to fight coronavirus are being lauded domestically and globally. He said 130 crore Indians are united to defeat COVID-19. Mr. Shah said it is high time Congress party should think of national interest and stop misleading people. Information and Broadcasting Minister Prakash Javadekar has termed Congress President Sonia Gandhi's reaction, blaming that the lockdown by the government is unplanned, as unfortunate and untrue. Talking to media in New Delhi today, he said nation has witnessed that many states banned public and transport movement in their respective areas. He said both airline and rail services were also suspended at the earliest in wake of novel coronavirus spread. He said the entire world is appreciating India's move of lockdown and describing it a right step at right time. The minister termed the lockdown a success. Mr. Javadekar said it is unnecessary politicization of issue of national calamity. He appealed to all political parties to refrain from making such political comments as COVID-19 is a serious pandemic.
We have to be united in this fight against corona. I hope that wisdom will prevail on Congress leadership also. Everybody needs to be on one page, on same page, and therefore we are just registering our comments. But I hope that such comments won't happen till we defeat corona.
Earlier, Congress Interim President Sonia Gandhi said the way lockdown was imposed with few hours of prior information created problems to common people.
This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi to share a video message with people at 9 a.m. tomorrow. Prime Minister interacts with all the chief ministers to discuss ways to check spread of COVID-19. Home Ministry blacklists 960 foreigners involved in Tablighi activities who came on tourist visa. Government launches Arogya Setu mobile app to assess and alert people on COVID-19. Government asks state to strictly implement lockdown measures in letter and spirit. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts. 328 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the past 24 hours in the country. With this, the total number of cases has now gone up to 1,965, including 50 deaths. Out of the total cases, 151 patients have recovered and discharged from the hospitals. Briefing media in New Delhi today, Joint Secretary Love Agarwal said around 400 positive cases of COVID-19 have been identified from different states including Tamil Nadu, Rajasthan, Delhi, Telangana, Jammu and Kashmir and Assam, which are linked to Tablighi Jamaat cluster. Mr. Agarwal said yesterday Cabinet Secretary Rajiv Gauba has asked the states to complete contact tracing of Tablighi Jamaat participants.
Home Ministry has asked states to ensure smooth disbursal of money to beneficiaries of Pradhan Mantri Garib Kalyan Yojana during 21-day lockdown to fight COVID-19. Home Secretary Ajay Kumar Bhalla has written to all the states and union territories and requested them to take all necessary measures in this regard. It said the Department of Financial Services had issued detailed guidelines on disbursal of money to beneficiaries of Pradhan Mantri Garib Kalyan Yojana through banks during the lockdown period. Home Ministry also asked to observe norms of social distancing. Tamil Nadu has reported 75 new cases of COVID-19, taking the total to 309 so far. 74 of the new cases are those who attended the Delhi Nizamuddin congregation, and another is a person with contacts with one of them. State Health Secretary Bila Rajesh told reporters in Chennai tonight that the patients are stable. All 1,103 people identified in the state as those who attended the conference have been tested, and the results of some of them are yet to be received. With the new tally, Tamil Nadu has moved to second place in the country in the list of states having the highest number of COVID-19 cases. Nearly 9,000 people who came in close contact with the new cases have been brought under quarantine. On the positive side, 7 patients have been discharged from hospitals after their complete recovery so far. Meanwhile, the Tamil Nadu government has announced a slew of incentives for those industrial units that come forward to manufacture medical equipment, protective gears and drugs against COVID-19 disease. Chief Minister Idapadi Palaniswamy today said all existing and new manufacturing units, including the small and medium enterprises, can avail the incentives. More from our correspondent.
Invasive ventilators, N95 type masks, antiviral and anti-malarial drugs that are being used to treat the symptoms of COVID-19, personal protective equipment and intensive care unit monitors qualify for the new incentives. The units are mandated to start the production of the medical equipment and drugs by the end of this July. The incentives include 30% capital subsidy with a ceiling of 20 crore rupees. All the other concessions that are applicable to the thrust sectors will be extended to the new units also. They can straight away start their production without waiting for any approval. As the need for more ventilators, masks and medicines are expected to shoot up, the move has been made to increase their production. Jai Singh, AIR News, Chennai.
In Manipur, state government has sealed off some areas of Thobal district after a person was found positive of novel coronavirus today. After 165-year-old male from Lilong of Thobal district who took part in religious congregation at Nizamuddin was found positive of COVID-19 today, the district administration initiated containment measures under the Manipur Epidemics Disaster COVID-19 Regulation 2020. An order issued by Deputy Commissioner Thobal said that the area within 3-kilometer radius of the house of the infected person has been sealed off and entry and exit of population from the containment area has been restricted. Schools and offices located in the area have been closed. Vehicular movement have been banned in the area. Meanwhile, Manipur Chief Minister N. Biren Singh said that the government has started the contact tracing of the infected patient. All the family members of the infected person have been sent to the quarantine center at RIMS Imphal. Addressing the people of the state, the Chief Minister said that lockdown is essential to combat the pandemic and urged them to stay at their homes and maintain social distancing. The Assam government has stressed on upgrading health infrastructure in the state to face the threat of COVID-19. State Health Minister Himanta Biswa Sarma said that 54 new ICU beds were inducted today at the Guwahati Medical College. He said that another 50 ICU beds will be added within 15 days. Mr. Sarma said that 16 positive cases have been reported in Assam so far. On the other hand, Forest Minister Parimal Suklabaidya has appealed people not to hurt wild animals if they sneak into human habitats. Mr. Suklabaidya said that there are reports that animals were roaming due to lockdown at some places. He appealed to people to report such incidents to the State Control Room instead of going after the wild animals. We spoke to Guwahati-based journalist and writer Samudragupta Kashyap on lockdown experience and activities.
Remaining in the confines of the four walls of home is a rare experience. It was difficult in the beginning, but has become smoother by now. I have a small garden where I tend to the vegetables and flower plants. Gardening is anyway a very good physical activity. While helping my wife in the household chore is also part of the new daily routine, we are also finding a lot of time to share life experiences with our children. I am also trying to complete a few book projects which have been pending for long.
In Kerala, 21 more COVID-19 positive cases were confirmed today. Among the new cases, 2 people had participated in Tabligh meeting in Nizamuddin. Here is a report from our correspondent.
The total number of people under treatment presently in the state is 256. So far, 286 positive cases have been reported from the state, among which 28 people recovered, including 4 foreigners. Chief Minister Pinarayi Vijayan said that in the video conference with Prime Minister, the situation of Kerala was apprised and permission was sought for the rapid test facility for COVID-19 and more fund allocation for the state. The state government also sought centre's intervention in the interstate goods movement in the country. Chief Minister further said that as directed by the Prime Minister, state government is appointing an expert committee to give opinion on measures to control crowd after the lockdown period is over. Mayusha for AR News from Thiruvananthapuram.
In Haryana, the number of COVID-19 positive cases has risen to 35 after 6 new COVID-19 positive cases were found today, which include 5 participants of Tablighi congregation. Out of these, so far 13 persons have been discharged after recovery and 22 COVID-19 positive patients are under treatment. The 3 Jamaati cases are from Palwal, 2 from Ambala. Our correspondent reports 66-year-old Nepal resident and 55-year-old Maharashtra resident were found positive at Ambala. They had come to Haryana from Nizamuddin after attending a religious congregation. 1 more positive case is from Rohtak. A spokesman of the health department said that the government has quarantined a total of 15,742 people so far, which include 15,389 people who had returned from foreign countries and 353 persons who were close contacts of COVID-19 positive cases. He said that so far, 1,039 persons have completed the quarantine period and currently 227 persons are in hospitals. He said that test reports of the 182 persons are yet awaited, whereas so far 885 persons who were sampled found negative for COVID-19. In Punjab, the number of COVID-19 positive cases has risen to 47 as 1 more person tested positive in Hoshiarpur today. Our correspondent reports that 1 positive patient from Amritsar died today and all close contacts of 41 active cases are kept in isolation. 1 person has been discharged after recovery.
Delhi government will provide financial assistance worth 5,000 rupees each to all auto rickshaws, Grameen Seva, e-rickshaw and taxi drivers in wake of difficulties faced by them amid lockdown situations. The amount will be transferred into their bank account. This was stated by Delhi Chief Minister Arvind Kejriwal during a digital press conference in the national capital today. Mr. Kejriwal said the process may take 7 to 10 days as government do not have bank account numbers of all the drivers. He said proper planning for this is being done.
ऑटो, आरटीवी, ग्रामीण सेवा, टैक्सी और भी जितनी पब्लिक ई रिक्शा, जितने पब्लिक सर्विस व्हीकल चलाने वाले हमारे भाई हैं, उनकी मदद के लिए सरकार प्लानिंग कर रही है. सबके अकाउंट में 5-5 हजार रुपए सरकार की तरफ से आपकी मदद के लिए डाले जाएंगे.
Talking about corona cases in the capital, he said out of 2,346 people evacuated from Markaz Nizamuddin, 1,810 have been quarantined and 536 people admitted to city hospitals. Mr. Kejriwal said simultaneous testing of all 2,346 individuals is being done, and due to this, data of infected persons in the city may shoot up in the next 1 to 2 days. He said till now there are 219 confirmed cases of COVID-19 in the city, including 108 from Markaz Nizamuddin. He said city has seen 4 deaths of infected, including 2 from Markaz. In Gujarat, the government has asked district collectors to ensure that workers and labourers are not terminated and are paid full wages by private companies in the wake of lockdown. This includes all the private firms, factories, shops and industries. Our correspondent reports that the government has also announced several decisions for the benefit of small milkmen and cattle breeders in view of lockdown.
Secretary to CM Ashwini Kumar said the small cattle breeders who are not a member of any milk cooperative can now deposit their milk to primary milk cooperatives. He said the decision was taken to ensure availability of milk and prevent wastage of milk in view of lockdown. As announced earlier, the government has transferred in advance the pension for the month of April to more than 13 lakhs beneficiaries, including widows, divyangs and orphans, to help them tackle coronavirus pandemic. Mr. Kumar said migrant workers will also be given free ration from 4th April under Anna Brahma Yojana. Aparna Khun, AR News, Ahmedabad.
The Jammu and Kashmir administration has been making all-out efforts to contain the COVID-19 pandemic. More from our Srinagar correspondent.
324 more persons who were shifted into administrative quarantine upon their return to Srinagar 2 weeks ago were discharged today after completing their 14-day quarantine period. So far, 638 persons have been discharged after completing the necessary quarantine. Jammu and Kashmir Services Selection Board has today approved the selection list of 550 junior staff nurses for the newly established government medical colleges in Jammu and Kashmir to augment the efforts of the health department to tackle the coronavirus pandemic. Meanwhile, Jammu and Kashmir Police has opened special helplines for old, sick and destitute people in all districts of Jammu and Kashmir with dedicated landline and cell phones. The police has also tightened its noose for the lockdown violators and has arrested more than 50 persons and seized a number of vehicles in Kashmir Valley. This is Sunil Kohl for AR News from Srinagar.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Prasoon Chatterjee, Geriatric Medicine, AIMS, suggested to the senior citizens to stay at home as they are more prone to catch the COVID-19 infection.
Seniors are most prone to catch the infection and they have highest mortality for COVID-19 because they have weak immune system, poor biological reserve, and they have multiple disease. So they must stay at home.
Dr. Ambuj Roy of Cardiology Department AIMS has advised their heart patients to follow social distancing.
My simple message to all of you today, especially heart patients, is that kindly, strictly follow the message of social distancing. It is to keep you safe and healthy.
To listen to other experts, tune in to our next bulletin. News Services Division of All India Radio will resume its Urdu bulletin during the day on its usual time, 1:50 p.m. from tomorrow. The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Naresh Gupta from Lok Nayak Hospital will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel, News on AIR Official. You can also follow us on the News on AIR app for updates.
Speaking on the precautions to be taken during the COVID-19 situation, actor Abhishek Bachchan has advised people to stay indoors and stay safe.
In these very difficult times, whilst we're all at home, social distancing, taking care of our loved ones, staying clean, hygienic, doing whatever we can to break this virus, to flatten the curve. I'm sure there are a lot of doctors and great medical practitioners who are telling you what to do and how to do it. Be happy, be positive.
The music maestro A.R. Rahman has penned a note of thanks to the doctors and all paramedical staff who bravely confront the novel coronavirus from the front line. In a tweet, he said, "It feels hard to see how ready they are to deal with the pandemic." He has pointed out that they risk their lives to save their citizens. The Oscar-winning composer has said God is inside the hearts of people, which are the most sacred shrines, and therefore asked not to cause chaos by congregating in religious places. He has strongly advocated to listen to the government's advice, adding self-isolation for a few weeks may give all many more years.
Prime Minister Narendra Modi had a telephonic conversation today with Chancellor of Germany, Dr. Angela Merkel. During the conversation, the two leaders discussed the ongoing COVID-19 pandemic, the situation in their countries, and the importance of international collaboration for fighting the health crisis. They also shared views on the inadequate availability of medicines and medical equipments required during the pandemic and agreed to explore avenues of cooperation in this regard. The German Chancellor agreed with Prime Minister Modi that the COVID-19 pandemic is an important turning point in modern history and offers an opportunity to forge a new vision of globalization focused on the shared interests of humanity as a whole. The Prime Minister informed Dr. Merkel about the recent Indian initiatives to disseminate simple yoga exercises and immunity-enhancing Ayurvedic remedies for people of the world. Dr. Merkel agreed that such practices could be very beneficial for enhancing psychological and physical health, especially under the present lockdown conditions.
Tourism Ministry has received more than 500 queries and requests for help from foreign tourists on Stranded in India portal in 2 days. The ministry had launched this portal for international tourists. The majority of the requests received from foreign tourists are seeking information for travelling back to their home countries and also looking at extension of the visas to stay in India while they cannot travel back. Tourism Ministry is coordinating with the Ministry of External Affairs and state officials to address these queries. It is coordinating with the respective embassies regarding problems faced by the guests. Emergency requests like need for food, medicine and care for elderly tourists is being expedited. Hotels are also being asked to follow the protocol and extend their support till the departure of such guests are arranged by the embassies.
Agriculture Minister Narendra Singh Tomar today launched new features of National Agriculture Market (eNAM) platform. It will help strengthen agriculture marketing by farmers, which will reduce their need to come to wholesale mandis for selling their harvested produce at a time when there is critical need to decongest mandis to effectively fight against COVID-19. These software modules are warehouse-based trading module in eNAM software and farmer-producer organization trading module in eNAM. Speaking on the occasion in New Delhi, Mr. Tomar reiterated that eNAM was launched in 2016 as a pan-India electronic trade portal linking Agriculture Produce Market Committee APMCs across the states. And now, before we end, the headlines once again. Prime Minister Narendra Modi to share a video message with people at 9 a.m. tomorrow. Prime Minister interacts with all the chief ministers to discuss ways to check spread of COVID-19. Home Ministry blacklists 960 foreigners involved in Tablighi activities who come on tourist visa. Government launches Arogya Setu mobile app to assess and alert people on COVID-19. Government asks states to strictly implement lockdown measures in letter and spirit. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the special news program on COVID-19.